Hello everyone, I hope you all doing well. In the previous video, I discussed about pharmacokinetic and their parameters involved in it, and I also said that I will discuss each parameter in detail one by one. So here today we will talk about absorption of the drug from the site of administration into the plasma. Absorption is basically uh, principle of physics and chemistry for the migration and passage of their molecule through the cell membrane. Absorption may be defined as the transfer of drug from their site of administration to the bloodstream. The process of absorption is completed when the drug is given by intravenous route, but when the drug is given orally, it must cross the cell membrane. Now we have to learn that what is cell membrane. Cell membrane is basically a sandwich. It consists of two lipid layers with protein layers on each side. The swollen part of the lipid layer is called hydrophilic or water soluble, while the hydrophobic part of the cell membrane is called lipophilic or lipid soluble layer, right? The water soluble part of the drug are passed through the hydrophilic portion of the lipid layer, while the lipid soluble drugs are passed through the hydrophobic part of the lipid layer. Here it is about the cell membrane and what kind of drug pass through which membrane, and most of the drugs pass through the pores of the cell membrane and enter into the bloodstream, right? Next we have the transport of drug through different process. We have three different processes: active transport, passive diffusion, and facilitated diffusion. We have to listen very carefully because these are different from each other with very minute differences. For active transport, we need a mediator. For passive diffusion, we need a driving force, and for facilitated diffusion, we need a carrier mediated. Right? If I discuss in further detail, like what is active transport, that will be continued as when we take drug orally, it forms a carrier complex and enter into the bloodstream, and this process continued, right? And the concentration gradient involved in it. How? From the region of low drug concentration to the region of high drug concentration in the presence of carrier, which requires energy in the form of ATP, right? It's all about the active transport, and and we also know that drugs are weak acids and the weak bases. These are not completely dissociate or ionized, and it contains the undissociate portion, and we know that undissociated portion rapidly pass through lipid bilayer of the cell membrane, whereas ionic portion of the drug is transported through cell membrane by active transport process, right? And the most of the ionic portion of the drug is passed through cell membrane by the active transport process. This is all about active transport, and next we talk about passive diffusion, which is the major and mostly used transportation method used by drug. It involves concentration gradient, and it also contain the driving force, which is provided by the concentration of the gradient, right? It is already taken or it is already understood thing that when we take drug orally, drug will be in a high concentration in GIT as compared to plasma. That is why this concentration differences act as driving force for the passage of the drug into the blood, right? And in this process, the drugs move from high concentration to low concentration, and the acidic drugs are better absorbed in acidic media, and that is also understood thing. And if we give an example of it, that it includes glycophenolin is the best example for the rapid absorption of the drug. Now, next we move towards the facilitated diffusion, which is carrier mediated, but it does not depend on any energy, and this process is carried out from the high drug concentration to low drug concentration in the presence of carrier, right? Now next we move towards factor affecting the drug absorption. Here are a number of factors which involve in the absorption of the drug. Very first, that is the concentration of the drug. As much as the concentration of the drug, the more drug will be absorbed, right? This is very common understood thing. but we have to keep it in mind that this absorption is continued through a passive diffusion, and in the result of it, drug shows quick action, right? Next we move toward the solubility of the drug. Lipid soluble drugs are more soluble in the blood because of composition of the cell membrane, that is lipid bilayer. And here we take the example of glycophyrin and some of the vitamins which are lipid solubles, and they show quick action. Next we move towards the next factor, that is surface area. As much as the surface area is large, the drug is exposed for more absorption, right? Small intestine provide a great surface area, that is divided into villi and projection, so greater will be the absorption through the small intestine. And the next factor, that is pH. Our stomach is of acidic pH, that is why more of the drug absorb in it. More of the acidic drug is absorbed in it, and the basic drug is absorbed in the basic media better. And next factor, that is weight of the body. As much as the weight of the body, greater dose will be required to absorb. So physician or clinician should keep in mind the patient weight and to prescribe a drug. And next factor is time of administration, that really matters, that either we are taking drug in the morning or evening, or empty stomach, or after meal. These are the different important factors which are very important to keep in mind to take a drug at right time. And next factor is disease state. If a patient have a compromised immune system, definitely drug absorption will be compromised. Here we take example of congestive cardiac failure. There is accumulation of blood in any part of the body because contraction of the heart is insufficient to expel the volume of the blood equal to that which fills it, right? The blood will accumulate into the hands, gut, etc. Due to the edema of the gut, absorption of the drug will be inhibited and the action of the drug will be slowed down. So next we have a factor. We should all we should keep in mind all these factors because the action of the drug is very important. And next we have the presence of the food in the GIT. As we know, the presence of the food in the GIT slow down the absorption of the drug. That is why most of the drugs or the presence of the food in the stomach matter the absorptions. If we take vitamins after fatty meals, it shows good absorption because of its reaction. And next we have route of administration. Route of administration is one of the most critical factor that affect the absorption. If we take IV drug, definitely the absorption will be 100% or maybe 99 or 98 or 98. Almost drug is absorbed through IV route, but through GIT it is but when we take orally, its absorption is compromised by GIT or other factors involved in it, and drug does not completely absorb. Next we have extent of circulation. Extent of circulation is very important factor. In the muscles, as much as healthy muscle, the blood circulation will be high. That is understood thing. And for example, buttock muscles which are very healthy and have high blood circulation, that is why doctors use muscles for the and for the administration of drug for good absorption. And next we move to the 12th factor, that is motility of the GIT. And that is one of also an important factor. If a patient suffering from constipation or having GIT motility problem and having a digestion problem, that also cause slow down the absorption process, right? We should also ask patient about either their stomach, their digestion is correct or not. And next process is degree of ionization. The drug absorption is inversely proportional to the degree of ionization. Greater the degree of ionization, lesser will be the absorption of the drug and vice versa, right? And next, that is a dose of drug. It is the minimum amount of the drug which is needed to produce the pharmacological action. If the dose of the drug is too small, it will be not produce any beneficial effect. But if the dose of the drug is too large, it will be rapidly absorbed and will produce a toxic effect. Thus, dose of the drug should be appropriate. These are the different factors I'm discussing that affect the absorption of the drug. Next, I have gastric emptying. It plays very important role in the absorption of the drug. For example, metoclopramide, which is an anti-emetic agent, causes gastric emptying, so absorption of the drug is slow and the action of the drug will be slow. Next, we have salt formation. In this drug present in the salt form, for example, phenobarbital, sodium are more soluble in water and form the solution. Thus, drug in solution form is rapidly absorbed through cell membrane and will show its quick action. Next, we have need of the body. It also affects the rate of absorption. A normal person cannot absorb iron not more than 10 to 20%, but in the iron deficiency anemia, large amount of the iron is absorbed, so the action of the drug will be quick. Physical state of the drug is also another factor that affect the absorption of the drug. That is, drugs are present in three dosage forms: liquid dosage form such as solution, solid dosage form such as tablet, and semi-solid dosage form such as suspension. And liquid dosage forms are rapidly absorbed, while solid dosage forms are slowly absorbed, such as tablets, because of the disintegration and dissolution. So absorption is slow, and the action of the drug will also be slow. The drug present in the suspension form are slowly absorbed from the site of administration and will show slow action, right? Last but not least, we have factors of age that slow down or faster the action according to the age. The lower the age, smaller should be the dose. The higher the age, larger should be the dose. In adults, larger dose is required, so absorption of the drug will be rapid and action of the drug will be greater. In small children or old aged people, smaller dose should be given and absorption will be slow, and the action of the drug decreases because in children and old age people there is immaturity of the blood brain barrier and enzyme system. Here I have discussed the number of factors that involve in the absorption of the drug, and also involve in the slowing down or quick action of the drug. I hope you all learn about all the factors, and next we will move towards the route of administration of the drug. I hope you all understand it, and today I conclude on this. So don't forget to like and subscribe my channel. Thank you. I hope you like it. Bye.